Now it's very nice that we actually get to know the differences between these two abdominal conditions. That's the Crohn's disease and also the ulcerative colitis. Differences between Crohn's disease and the ulcerative colitis. So all of them, they're actually basically issues, all right, in the stomach. You understand? Or the colon, the gastrointestinal tract, to be general. So differentiating them, of course, you use different comparisons. So based on this, Crohn's disease is this, ulcerative disease is this. Based on this, is like this, is like this. Do you understand? So from there, you get to know the differences. So this is ulcerative colitis, this is Crohn's disease. You can see that ulcerative colitis is mainly in the small intestine down to the rectum, while the Crohn's disease any place in the gastrointestinal system. So that's just one of it. Let's move. So both of them, you should know that collectively they call them the inflammatory bowel disease. That's the IBD. So they're actually from the same mother, okay, but they differ in so many things. So let's look at those things. So based on location, Crohn's can involve any part of the gastrointestinal tract, okay, mostly the terminal ileum and the colon, while ulcerative colitis, small intestine and the rectum mostly. All right. So patterns of inflammation. Crohn's inflammation is patchy with areas of normal tissues between inflamed segments. Skip lesions is painting your abdomen. Is here, is jumpy to here, is jumpy to here, is jumpy to here. The others it's not really straightforward, you know what I'm saying? So basically, but ulcerative colitis is the inflammation starts down, going from up straight down. Ulcerative colitis would basically say is much more organized. Now, just to say that ulcerative colitis could also occur in the large intestine, but mostly in the small intestine down to the rectum, most at times, So depth of involvement, Crohn's is transmural, so full thickness of the bowel wall, while the ulcerative colitis will affect only the mucosal and the submucosal layers of the abdomen. So symptoms: Crohn's is abdominal pain, weight loss because you don't want to eat, because when you eat there's pain, the malabsorption. Then ulcerative colitis is bloody diarrhea, urgency, tenesmus, left-sided pain. So that's what I was telling you guys, mostly on the small intestine. The small intestine is located on the left side of your abdomen. Do you understand? So mostly the pain is localized around that side. The patient is bending towards the left, even as they are talking to you, so they are picking it up. So complications: Crohn's can result in fistulas, strictures, perianal disease, nutritional deficiencies, mostly deficiencies of vitamin B12 leading to pernicious anemia. While ulcerative colitis could lead to toxic megacolon, high risks of colorectal cancer with long-standing disease. Okay, so basically that's just it, right? A whole lot of differences between them,